Stimulants, drugs that speed up the body's functions. Examples: amphetamines, chemically manufactured stimulants. Methamphetamines, strong central nervous system stimulant that is mainly used as a recreational drug. Cocaine, made from the coca shrub, a stimulant drug that can cause heart damage. Crack, a small, hard chip derived from cocaine. Caffeine, a stimulant drug found in cola beverages and chocolate. Nicotine, a stimulant found in tobacco. Possible effects: increased alertness, excitation, euphoria, extreme happiness, increased pulse rate and blood pressure, insomnia, can't sleep, and loss of appetite. Withdrawal: severely depressed mood, prolonged sleep, apathy, don't care about much, irritability, and disorientation. Effects of overdose: agitation, increased body temperature, hallucinations, convulsions, and possible death. Other info: a common cause of death for stimulant users is a heart attack. The user's heart gets beating so fast that he can't keep up with itself and therefore arrests. Depressants, drugs that slow down the body's functions. Examples: barbiturates, depressant drugs that produce sleep. Alcohol, a depressant drug found in whiskey, beer, wine, and wine coolers. Hypnotics, psychoactive drug used to induce sleep. Sedatives, induces sedation by reducing irritability or excitement. Tranquilizers, drugs that cause a person to relax, used to relieve anxiety. Quaaludes, reduce anxiety, sedative hypnotic drug. Possible effects: slurred speech, disorientation, staggering, and general drunken behavior. Withdrawal: anxiety, insomnia, tremors, delirium, convulsions, and possible death. Effects of overdose: shallow respiration, cold and clammy skin, weak and rapid pulse, coma, and possible death. Cannabis products. Marijuana. Marijuana is made from the hemp plant, Cannabis sativa. The leaves of plant are dried, crumbled, and smoked. Street names for marijuana: pot, grass, bud, dope, Mary Jane, weed, etc. Possible effects: euphoria, relaxed inhibitions, increased appetite, affects coordination, judgments, impaired memory up to 3 to 4 weeks after its use, and shortened attention span. Withdrawal: insomnia, hyperactivity. Effects of overdose. Although no one has actually overdosed on marijuana, overuse of the substance can lead to fatigue and paranoia. Amotivational syndrome also occurs in marijuana users, as with alcoholics. Did you know that smoking 3 marijuana joints per week for 3 to 6 months carries the same probability of developing lung cancer as smoking a pack of cigarettes daily for 20 to 30 years? When marijuana is used with alcohol, it shuts down the ability to vomit. The stomach can't get rid of excess amounts of alcohol. Alcohol poisoning can result. THC is the active ingredient in marijuana, what produces the effects of this drug. The THC found in 1 marijuana joint can stay in the body, fatty tissues, brain, etc., for a month or even longer. 1 joint marijuana impairs a person more than having a blood alcohol content, BAC, of 0.10%. Marijuana weakens the immune system, which protects us from disease. A user is less able to fight off viruses, produce white blood cells, and destroy tumors. Women that use marijuana can experience problems with their menstrual cycle and fertility. Male marijuana smokers tend to have fewer sperm cells. Anabolic steroids. Public awareness of anabolic steroids has recently been heightened by the media about their use by amateur and professional athletes, including Chris Benoit, pro wrestler. Anabolic steroids are artificial forms of the male hormone testosterone that promotes muscular growth and development. Steroids are available in 2 forms: injectable, solution, and pills. These drugs are illegal unless they have been prescribed by a medical doctor, prescription only. Many people use steroids as an attempt to develop a good body physique, the ease and somewhat effortless and lazy way. However, a lot of these people don't have a clear understanding of the physical and psychological effects that steroids can have on them. Physical health risks for males and females: hypertension, high blood pressure, liver damage, heart disease, kidney disease, sterility, stunted growth, severe acne, death. Physical health risk for males only: decreased sperm production, decreased testicle size, baldness. Physical health risk for females only: breast shrinkage, development of masculine features, example facial hair, a deep voice, and baldness. Psychological health risk for males and females: extreme paranoia, hallucinations, mania, severe depression, extreme aggressiveness, roid rage, irritable behavior, severe mood swings, risk of AIDS transmission through the use of shared needles. Inhalants, street names: glue, kick, bang, huff, poppers, whippets, Texas shoeshine. Inhalants are chemicals that produce vapors that, when inhaled, sniffed, or huffed, can cause hallucinations as well as create intoxicating and euphoric effects. Inhalants are common household products that are legal to purchase but are potentially dangerous when used incorrectly. Some examples include rubber cement glue, gasoline, nail polish remover, paint thinner, model glue, cleaners, and much more. Since these products are inhaled, the volatile chemicals in these products reach the bloodstream within seconds, varying upon level of dosage. The user can experience slight stimulation, feeling of less inhibition, and or loss of consciousness. The user can also suffer from sudden sniffing death syndrome. Users can die by suffocations, choking on their vomit, or having a heart attack. This means the user can die the first, 10th, or 100th time he or she uses an inhalant. Narcotics, a drug that reduces pain, alters mood and behavior, and usually induces sleep or stupor. Examples: heroin, a depressant drug made from opium; opium, a narcotic drug made from the opium poppy plant; codeine, a depressant drug often found in cough medicine; morphine, a drug made from opium and sometimes used medically to relieve pain; methadone, a painkiller that is also used for treating heroin users. Possible effects: euphoria, drowsiness, slowed respiration, and nausea. Withdrawal: watery eyes, runny nose, yawning, loss of appetite, tremors, panic, chills and sweating, cramps, and nausea. Effects of overdose: slow and shallow breathing, clammy skin, constricted pupils, coma, and possible death. Other info: since many of these narcotics are injected into the body by the user, any users contract hepatitis and or HIV. More deaths occur in heroin users than in other drugs combined. Approximately 60% die from overdose. Another 25% die due to infection, and the final 15% die as a result of violence. Hallucinogens, any drug that causes a person to hallucinate. Examples: LSD, a potent drug that produces hallucinogens, changes the way the senses work, the most potent hallucinogen. PCP, also called angel dust, can cause disorientation and violent behavior. Mescaline, derived from the peyote cactus, produces effects similar to LSD. Possible effects: visual illusions, hallucination, altered perception of one's own body, and increased emotionality. Withdrawal: flashbacks. This means that if something happened to a person while they were under the influence, and or the person may experience a semi-high at uncontrolled times. Effects of overdose: more prolonged episodes that may resemble psychotic states. In extreme cases, people can become permanently vegetative.